Good morning, my name is Mike. I'm an RN. I work at the VA hospital. Today I want to give you like a little briefing on pneumonia. Some of the things I want to cover today are like the definition, the etiology, the pathology, what the diagnosis is, some of the symptoms you could encounter, some of the complications, the treatment protocols, and we'll talk about a little bit about dietary needs with the patient with pneumonia. So let's start off by what is pneumonia? Let's do a definition for pneumonia. Pneumonia, it's an infection of the lungs, basically, with a range of possible elements or causes, such as like bacterial, could be viral, also it could be fungal. So there's a multitude of symptoms and causes for pneumonia, but I'm not going to go too deep into it because today's a short brief, so we're just going to cover just a basic definition of pneumonia. Okay. What is some of the etiology? Pneumonia, it's basically, like I said, it's an inflammation of like the air spaces in your lungs. Most commonly, it's due to like an infection, like I talked about, either viral, bacterial, or fungal. Less frequently caused by fungi, mostly bacterial, I think, is what it mostly is, bacterial. The lungs become inflamed, and then the tiny air sacs, or the alveoli inside your lungs, they start to fill up with fluid. And that's where they run into the complications with the oxygenation and being able to breathe properly. The most common bacterial type that causes pneumonia is Streptococci pneumoniae. That's one of the most common bacterias that causes pneumonia and causes problems for the patient. It just causes a lot of issues as far as with the air fluid sacs filled up and difficulty breathing. Some of the pathophysiology, just real brief. I'm not going to go too deep. I just want to give you the basics on it. So the bacteria reaches like inside the alveoli. What that does, it causes a reaction. The body reacts to it. The body's immune system, the immune system causes an inflammation, and what that does, there's exudation of fluid or excess of fluid that builds up in the lungs. The white blood cells, they migrate to the alveoli. There's a consolidation of all those factors and functions inside the alveoli. And what that does, it causes some edema. And then what that does, on top of that, it's kind of like a cascading effect. Then there's some blockage of the alveoli and the bronchi, which of course causes more problems with breathing and oxygenation status. So there's poor alveoli oxygen that gets to the lungs, which makes it more difficult to breathe, which causes more problems. So what would you do? Like, what's the diagnosis for pneumonia? Basically, the physician will do like a medical history and a physical examination. They'll do like an H&P, listen to the lungs, see what they hear as far as that they hear fluid in the lungs, or they hear rasping or whatever kind of sounds they hear. Normally that's how they'll try to diagnose it. Also, they'll do blood tests to check the white blood cell count. Y'all know if the white blood cells are elevated, there's probably some form of infection going on. So to detect viruses, bacteria, or other organisms, they do the blood test to check for those issues also. And like one of the main things they probably would do is a chest x-ray, so they can see what's going on to actually confirm the diagnosis of pneumonia. And in some cases, they might even have to do a CT scan, but it all depends as needed per case, per patient. Some of the symptoms you would see is chest pain when you breathe or cough, confusion. Like in older patients, you'll see confusion and the mental awareness. Like people like older than 65, a lot of these issues will happen. You'll have a cough, like I said, which produces a lot of phlegm, which makes it more difficult to breathe. Fatigue is a big one. You get real tired. Fever, sweating and shaking with chills, it's a possibility. Nausea, vomiting or diarrhea, that's a possibility. And like I said, shortness of breath, that's one of the biggest ones. Hard to breathe because the lungs are filled up with the fluids inside the alveoli, inside the air spaces. So it's really hard to breathe inside the lungs. So what are some of the complications? You could get bacteria in the bloodstream. Then you get bacteremia, which causes more problems as far as bacteria in the blood, transporting through the blood. You're going to get a lot more issues, a lot more complications. Difficulty breathing. Possibly, if it gets so bad, you might have to go into a ventilator, to help you breathe, or put oxygen on your, get oxygen mask just to maintain that oxygenation status. Fluid accumulation in the lungs is another big issue. You could get pleural effusion. They would have to use a chest tube if that would happen, or even surgery if it gets really, really bad. And lung abscesses, but that's usually treated with antibiotics, which is like the first course of therapy. So the treatment protocols, antibiotics is the first line treatment. Hopefully that will take care of the issue. Excuse me. Cough medicine, like if you're for home remedies, is another one to help calm your cough. And fever reducers and pain relievers, such as like common household like ibuprofen, Motrin, aspirin, or Tylenol, really helps with the fever, to reduce that fever and get that temperature down. Some dietary concerns. An adequate protein intake is essential to repair those tissues that get damaged, as far as from the pneumonia. Any kind of tissues in there need to get repaired. That protein is going to repair that tissue. It's also important to get proper vitamins and minerals, so you can strengthen your immune system and avoid any kind of malnutrition that could happen from the pneumonia. Also, hydration is key. It's so important to loosen those secretions and improve oxygenation status so you can breathe better. That's a big one, hydration. So if we we do a little reflection right now of what we learned so far. Maybe think about a patient that you had in the past with pneumonia, or think about, hey, you know what? I might get a patient in the future that has pneumonia, and I can remember some of the stuff that Mike had taught me on this pneumonia class. Just some basics. I'm not going too deep. I'm just giving you the basics of pneumonia, just a little overview. So I want you to reflect on that. Think about a time, maybe write it down, and just kind of, think about what you know and what I taught you today as far as what you know about pneumonia, and kind of compare the two. It just helps to reflect on what you've learned in the past, because it makes you a better nurse in the future, moving forward. So we'll do a quick little review. We talked about the definition, the etiology, the causes, the pathophysiology, just a brief pathophysiology we talked about, the diagnosis, some of the symptoms, complications, some of the treatments they could do for pneumonia, and we talked about the dietary concerns, some issues there also. So in conclusion, like I said, this is a very brief overview. I could go a lot deeper if I had more time, but this is just a basic overview, just to kind of give you guys a heads up. I mean, we all learn this in nursing school, but we forget as time goes on, and if you haven't had a pneumonia patient in a long time, you kind of, you don't have that information readily available to you right in front of you. So in conclusion, what could help, avoid some of these issues with pneumonia is lifestyle changes. If you're a smoker, avoiding smoking is not number one, but it's a big issue as far as, the smoke damages the tissue, which increases the risk factor for more infections in the lungs. So lifestyle change as far as smoking would be a big one. Getting enough rest and recuperation, and some just moderate exercise is really good to do. A diet which is rich in fruits and vegetables and whole grains is very important to help make the body stronger and fight the infections. Another big one is, like on our unit, get infected with the pneumococcal vaccine. That's a big one. And also yearly get the flu vaccine every year. And one of the biggest ones I could probably say is wash your hands. Your hands are so dirty. To avoid infection, we learned that in nursing school over and over again. Wash your hands. That's a big one. So I hope you learned something today. Just a brief overview on pneumonia, like I said. Excuse me. I just hope that you learned a little bit today as far as, if you do, like I said, if you do encounter that patient, you're not totally lost. You kind of have at least some idea of how to handle the situations. The complications, the symptomology, the etiology, the diagnosis, and how would you treat the patient. So, and also the dietary concerns like we went over earlier. So with all that in mind, just like I said, reflect and think about what I talked about. Think about what you know, kind of combine the two, and then like I said, that makes you a better nurse as far as, diagnosing that patient, kind of understanding what's going on, how to treat the patient, what you're going to do, and then so on and so forth. So with that being said, I hope you have a great day. I hope you learned something today, and take care, and God bless.